Hello everybody, how are you? You must have watched our first episode. I had three wonderful doctors I'm lucky enough to have with me even today. One of the major issue of today's life, I understand it, the environment and the way human beings are damaging this beautiful environment, that is also a factor, and then our lifestyle and the use of electronic equipment, the use of processed food, these all things are contributor in our heredity as well. We had all these programs with Dr. Anthony, and where Dr. Anthony emphasized that obesity is mother of all the problems, diabetes, heart conditions, and now in our previous program you watched that it is a contributor towards the infertility as well. And we are lucky enough, along with Dr. Anthony Leeds from London, one of the great researchers, we do have Dr. Channa. He's a consultant in reproductive endocrinology at the St Mary Hospital in London, clinical senior lecturer at the Imperial College London, leads a research group that aims to develop new treatment for the men and women with the infertility. A great man, and of course we are lucky to have him with us. Dr. Channa, I will introduce you first. Thank you very much. So this is Dr. Channa. Hello. Hi, Dr. Channa. Okay, this is Dr. Channa. Now, I would introduce Dr. Aditi Sharma. She is specialist registrar in diabetes and endocrinology at the Imperial College in College NHS Trust in London, clinical research fellow Imperial College London, currently studying the weight loss in men with infertility. So the ratio between weight and the infertility, she is looking after that part. Just published a major review of the cause of male infertility. Dr. Aditi, hello.
Hi.
What a wonderful girl. My God, I'm very lucky. And the best of all is Dr. Anthony Leeds. Dr. Anthony, good afternoon.
Hello.
And how are you?
I'm very well, thank you.
Dr. Anthony is very serious because he just deals with the research, and that's it. That is the reason sometimes I think it's good to accompany him, but it's good that I'm not a researcher. Yes, Dr. Anthony.
I was going to say thank you very much indeed for asking us to join to do this second segment on fertility. And one of the issues, as you know, is that globally fertility in men is falling. And there are a number of reasons for this. And I wonder, Aditi, if you want to just recap on the issues that we are aware of, and when you see a patient in the clinic, what points do you actually discuss with them?
Firstly, thank you for having us here today. Very important topic. I think two very important topics, one being male infertility, one being obesity, and especially today talking about the link between the two. So when we see a patient who presents to a fertility or infertility clinic, obviously very important to see both the male partner and the female partner and taking a good history, finding out about their lifestyle, finding out about their weight, and other factors that are genetic factors or acquired factors that may contribute to infertility, and then going ahead and doing a full examination and then going and doing blood tests. But on the topic of lifestyle, so very important to look at things that can be modified. So looking at weight being one of the major risk factors for infertility, both in men and women, and other adverse lifestyle factors such as smoking, alcohol. We talked in the last segment about other things like cycling, tight clothes, especially for the male partner. So looking at all those modifiable factors to optimize the couple from improving the chances of conception.
Do we have any indication of the proportion of the scale of the problem? So with a couple attending an IVF clinic, what proportion is attributable to male infertility and what proportion to the female problems?
Yeah. So globally, the estimate is that nearly 1 in 7 couples are infertile, which is about 15% of couples. But obviously, looking at the cohort of men that attend or couples that attend infertility clinics, nearly up to 20 to 40% that are considered to have male factor infertility. And out of those, nearly half of those are obese. So, have a higher body fat percent.
Yeah. So the next question is the inevitable one is, well, what can we do about it? And I know that you're undertaking experimental work at the present time. Do we have any idea yet from clinical practice and from the literature about how much weight needs to be lost? I think there may be some clues in the existing literature, but from your own practice, do you have any idea about the amount of weight loss that seems to be beneficial in individual cases that you've seen?
Yeah, that's a very good question. It's difficult to give a number because it's individualized to the person. But if I was to look at guidelines, so if we look at the American Association of Diabetes guidelines, or we look at the Obesity Association guidelines, there's a recommendation of 7 to 10% weight loss. And obviously, including the NHS, National Health Service UK guidelines, they recommend having at least 150 minutes of exercise, moderate intensity exercise in a normal weekly period. So that's the generic advice that's given to males, females, regardless of the infertility issue. No one's really looked into how much weight loss is needed for improving fertility in men. We're doing the first study looking at whether there is what is the association between the two. But I will mention one of the studies that was done back in 2011, which was one of the first pilot studies that actually looked at obese men, so men who were, had a body mass index of above 30, and made them undergo a weight loss program. And in that cohort of men, they had about 43 men in that study, and they found that the men that lost nearly 17 to 25% of weight, so quite large amount of weight, they found that it actually improved their semen parameters and improved their reproductive hormone profile. So based on that study, it's as high as 17 to 25%. And then there are other observational studies that have gone to the 10 to 12% mark.
That's very great, Dr. Anthony. I have a question over here. As I was looking at her, she is with diabetes and endocrinology. Now, with the weight gain, we did this program previously with Dr. Anthony, that diabetes, when there is a fat around the pancreas, that that has an effect on a person's body, and that if that fat is reduced, diabetes can be reversed. Now, the fertility is also mainly controlled by our hormones, endocrine glands. Now, my question to you is, in the women, there is fibrosis. So this means the weight gain, and there is a link between weight gain and fibrosis, which is a main cause of infertility in the woman.
Yeah, so a lot of research has been done in women. So we know that women who are overweight or obese have menstrual irregularity. So they've got ovarian dysfunction. So they don't release an egg perhaps every menstrual cycle. There is what we call insulin resistance in women. So there is a very definite link of obesity with female factor infertility. And that can be because of multiple mechanisms. One of those, what you have already mentioned, it could be because of inflammation that obesity causes in the body. It could be around the ovaries, other organs, as you've mentioned. In the male partner, there hasn't been many studies that have looked at that, but we do know, similarly, as you've mentioned, the pancreas and diabetes, that the testes can have increased scrotal fat, which again can cause similarly, so increased fat around the testes. Testes is the organ which is important for spermatogenesis. That is where sperm is produced in men. So again, how that increased fat can cause increased inflammation in the testes, and that can adversely affect sperm quality and sperm function, which can affect fertility outcomes.
When we talk about the quality of the sperm, it means they are less, their movement, it affects their movement, like the running towards the egg, what it is? What do you mean by that?
Again, very good question. So there are different parameters that are looked at in the lab when a man undergoes a semen analysis. So we look at the count, which is one of the most important parameters, and it's associated with fertility outcomes and time to pregnancy. So we look at how many are there. We look at how good they move. So not just move, but move forward. And as you've suggested, you need the sperm to move forward to meet the egg. And how do they look under the microscope in terms of the morphology? So do they have a normal looking head? Do they have a normal looking neck? Do they have a normal looking tail? So all of those things are important when we talk about sperm quality.
What is the age of a sperm?
So again, it's again dependent on what species. So in men, the approximate is that every 3 months is the cycle of spermatogenesis.
No, once released, what is the period it stays in the uterus? Like,
oh, yes.
I might ask Channa to answer that.
Yes, Dr. Channa.
Yeah, it varies, but sperm can survive for a few days, which is why couples, so when couples are advised to really start, if couples want to try and have the best chance of having a baby, then, sex once or twice a week is normally adequate for most couples. Yeah, so the sperm will last and survive there for a few days.
So this means if this is a tip for those who want to conceive. So this means during the time when the egg is released twice, and then Dr. Channa can explain. It's only there's a tip for those who want to conceive. Dr. Channa, you can give a better tip for that. I'm a layman.
Of course. So the first, so let's say a woman has her period today. So between 1 week and 2 weeks from today is when most women will release an egg.
Okay, so once the menstruation period is over, like 10 days to 15 days is the time when egg is released.
Oh no, you time it from the first day of the period. So
okay,
let's
the
say
day
the
when period starts.
Yes, period starts. When it ends isn't important because that will be different from woman to woman. Okay. But let's say today the period starts, then in 7 days' time starts a week when most women will have released their egg. So for many couples, they may choose to have sex, particularly during that time of that week. But to be honest, sometimes an egg can be released outside of that golden week.
Wow.
And that's why it's practice to, I think if we ask couples to just say, right, this is the time, this is what we do, bang, bang, bang. You also need to, as a couple, enjoy each other's company and enjoy the spontaneity. So we know that there's this week when eggs are most likely to be released, but I would also say it can be very stressful if you live by a calendar.
Okay, so in a simple words, it is from the day of menstruation, 1 week to 3 weeks. 1 week to 3 weeks is the period, peak period. Is a peak period.
Yeah.
Now, in this peak period, Dr. Channa, my question is, what should be the frequency of mating, and then how frequent? Here comes the life of sperm.
So different studies will say different things. If a man has a low or a poor sperm quality, it doesn't matter what type, a lot of doctors would recommend that you should mate as often as possible. It doesn't really matter how often you do it, because the sperm is not so well, and therefore maybe
the probability should be more.
Yeah, so 2 or 3 times a week is adequate, I would say. And even for men with normal semen quality, I think there's no real science to it. I would say 2 or 3 times a week is excellent. If you're actively...
Can I bring
yes,
us back to weight? One of the other interesting areas is that, of course, in some countries, perhaps not so much in Canada, but in Europe, bariatric surgery is a treatment that is often used for individuals, particularly with diabetes and obesity. Do we have any information about the effect of weight loss following bariatric surgery on male fertility?
Yeah. Again, a very, very exciting field, because we've so far talked about the fact that we know obesity is a risk factor for male infertility. And then we're looking at weight loss options to see whether that would improve male fertility. And we know that bariatric surgery is one of the most effective ways of weight loss. Men or women can lose about 30 to 60% of their body weight after a bariatric surgery. Mm-hmm. Interestingly, all the studies that have been done looking at male fertility after bariatric surgery have shown that actually there's improvement in the hormone levels. So things like testosterone improves after bariatric surgery, the weight loss from bariatric surgery. However, the semen parameters, so the sperm quality, is actually adversely affected after bariatric surgery. So there are some case reports that have looked at men getting secondary infertility after bariatric surgery. And there was a large meta-analysis that was recently published as well, looking at bariatric surgery and sperm parameters, that actually showed that up to 2 years after bariatric surgery, there was no improvement in parameters.
Yes.
So to what we would actually expect, or we would, looking at the association.
Yes. And I think that sort of raises the question that perhaps the amount of weight loss which is desirable to specifically address male infertility may be an intermediate amount between what is achieved with bariatric surgery and what is achieved with a conventional diet, where you might achieve 4, 5, 6 kilograms weight loss, whereas surgery delivers 30 kilograms or so. And you mentioned the 7 to 10% weight loss right at the beginning there in the general guidelines, yeah. And that would translate into somewhere around 10 kilogram, 12 kilogram weight loss. Using special diet, and the ones that we do use experimentally that I've used and that you've used as well are the formula diets, 800 calorie diets, which enable you to have a big initial weight loss of, anywhere between 10 and 15, and in some men they can even achieve 20 kilograms weight loss. I've seen that as well. And it may well be that approach, which I believe is the one that you're currently investigating at the moment, may be the one to use.
Correct. So our study that we are currently undertaking at Imperial College is looking at lifestyle, way of weight loss, specifically looking at low energy diets. So we're looking at formula diets and how they can induce modest amount of weight loss to investigating how that affects the sperm parameters. So that's what our study is about. And I completely agree with you that maybe there is a threshold of weight loss, and it may be that surgery leads to too rapid a weight loss, and also leads to nutritional deficiencies that may be essential for spermatogenesis. And it may be that modest weight loss by diet, including the formula diets, may be what might give us the optimum weight loss for male fertility.
There is some experimental evidence in other contexts whereby formula diets do actually improve nutritional status. It hasn't been adequately investigated, but this is an area that I think needs to be thought about. So it might improve, for example, zinc status if that was of relevance to fertility. Mrs. Arifa.
Yes, Dr. Anthony, once we are talking about the food, I understand our basic subject is obesity, and obesity is mother of most of the sicknesses. And Dr. Anthony Leeds has a lead on that. But today's specific topic is obesity linked with fertility or infertility. Now, you're talking about the diet. This is a very fast, badi tez zindagi hai. Most of the people, they go with the fast foods and the easy way, like the tin food, and lots of insecticides are used on our food. Lot of fertilizers are used in our food. Is there any effect, and how can they change that lifestyle? Does that lifestyle affect the fertility in the long run?
Who wants to answer that question? Aditi, do you want to start?
It's difficult to conclude as into which diet, but there are studies that have looked at different types of. They've looked at, for example, the Mediterranean diet, or the low carb diet, or the keto diet, and looked at how these different diets cause weight loss and what they do to reproductive hormones. But no study has really looked at these different diets on male fertility. So that's an unanswered question. But we do know that these different diets do improve overall health of the patient, and improvement in their metabolic health, so things like diabetes, blood pressure, etc.
Dr. Sharma, Mediterranean food is a healthy food, but my concern was the tin food, preserved food, and these sausages what people use. And my concern is the use of fertilizers on the food, like, just to, especially for the chicken what we eat has so much. Yes, Dr. Channa, would you mind to address that?
Yeah, yes, of course. I think you've touched on an important topic here. So, I mean, if we go, one of the big questions, I know that Dr. Leeds and Dr. Sharma, would probably agree with me on this, is how important is environmental pesticides, plastics, pollution contributing to the problem of male infertility? And I think it may work in combination with a poor diet and poor lifestyle to make things worse. The problem, of course, is because everyone in the world is exposed to these factors, it's difficult to find people who are not exposed and design experiments to test it adequately. So we can't scientifically prove at the moment that these are having a serious effect. But I think if you ask people in the field, we all suspect so.
I think it's also important to comment that quality of food is very carefully managed and monitored in places like Canada, the United States, and in Europe. And while there may be minute traces of some of these compounds, the system doesn't allow any foods that are contaminated with unacceptably high amounts to come through into the food chain. So this is very, very carefully managed. Yet, what we're concerned about perhaps are the absolutely minute traces of some compounds that do come through. And as you say, it's very difficult to study this area.
Dr. Anthony, time goes so fast, and there are so many unanswered questions. But you know what? Time doesn't allow us to go any further. Dr. Anthony, as I said about these, I need a quick answer from you. We did talk, I was asking this question about the fertilizers and pesticides and hormones given to the animals, chicken and the goats and all these animals. Ultimately, We are the end users. Definitely it affects on our body. Even the human beings are intervening or interfering with the environment so much. You were telling that there is an infertility problem in the animals as well.
There is evidence from some groups of animals in other parts of the in parts of the world where perhaps environmental contamination has affected fertility in, for example, some reptiles. So this issue of general environmental contamination and then very specific local environmental contamination, for example, with contraceptive hormones coming through in water, so a reptile living in water which is drawn from that source can be affected. But that's a problem that's outside our scope and our area of specialist knowledge. But what we're concerned about is the very specific problem, which is a growing problem of men and women being infertile, and are trying, by applying high quality scientific research, to actually get some answers. And the key one, I think, is that we will shortly have some good information, hopefully good information, about the effect of an adequate weight loss in men.
Thank you very much.
Yeah.
And
Yes.
you know what, this program, मेरा जो program है, I always set role models. Of course, हमारा program health tips के मुतालिक है, मोटापे से मुतालिक है, मोटापे से मुतालिक diabetes को हमने cover किया, heart conditions को हमने cover किया, आज हमने infertility को, this is our second program. But along with that, when we meet with the people, I think one thing what I would, as a value I would like to talk about is, our company counts a lot, who we sit down, who we talk to. And once I talk to the people, I definitely highlight that. It's very nice, Dr. Channa talking to you. It's very nice, Dr. Sharma talking to you. And I think, and Dr. Anthony, all the successful people are calm like you. Is that right? How this, Dr. Anthony, how can I get that calmness what all three of you have? Give me one tip.
Good preparation. or very thorough preparation for whatever task you're faced with in the future. That's the key thing, I think. Aditi and Channa?
Yes, anything you would like to add? You know, as I said before, that there are many questions left unanswered. This COVID-19, the mental issue has increased, and I wanted to ask, I don't have time now, that this mental issue is it also contributing towards this kind of problems, infertility, stress in the women, thinking about that I can't conceive, I can't conceive, I can't conceive. Does it contribute towards the infertility? Unfortunately, we'll get another time from them. Yes, Dr. Sharma, you quickly cover it, and Dr. Channa, if you can put a little light on it.
Yes, of course. When I speak to couples, I do firmly believe that sometimes worrying too much can stop the very thing you want to happen. So I do believe in the psychology of things, and I do believe having a plan. I think the more that you sit down with a couple early, or the couple sits down with each other early and says, how do we make best use of what we have, how we get ourselves healthier, maybe join a gym, maybe enroll in a weight loss program so that we can make a real difference in our lives. And I think if you have a plan and you say, okay, we may not get, I meet couples who try to get pregnant in a month, and we know that that's not always possible, but most couples will get pregnant within a year. And I think...
But don't be stressed out.
Exactly. Have a plan, know that it can take up to a year, do the right things, make yourself as healthy as possible, and trust that things will happen.
Thank you.
Don't panic.
Thank you. Yes, Dr. Sharma.
I completely agree with Dr. Jayasenna. I think stress can adversely impact what the couple is trying to achieve. And I think, as we said earlier as well, give yourself time. And, you know, if you're plan in advance, give yourself that 1 or 2 years that it may take, rather than leave it too late. And lead a healthy lifestyle to improve the chances.
Thank you very much. Yes, Dr. Anthony, quick word from you.
Well, I agree absolutely. Being knowledgeable as well, and that actually, of course, introduces the whole question of public health information. And at the end of the program, we're going to put up a panel, which is some web links to the infertility information for Canada, India, Pakistan, and also for the United Kingdom. So that may be helpful. But finding out all the things you need to know, I think that's the key thing. A key thing.
Thank you very much. Hakuna Matata. Have fun. Enjoy. This life is too short to be lived. If you will be happy, you will be conscious about your health. Just eat healthy, stay healthy, do exercise, and look after other human beings. God will bless you with everything. Thank you, doctors. Thank you very much, and see you in next episode. God bless. Bye-bye.
Thank you. Bye-bye. Bye-bye.
Thank you so much.
Thank you.